Hello, this is the training module for the use of empagliflozin in the recovery trial. This is the current design of the trial, which you will be familiar with, where eligible patients, that is to say patients with proven or suspected COVID-19 who have been admitted to hospital, are randomized into arms which are both available at your hospital and suitable for the participant. Not all arms are available at all hospitals or in all countries. Participants are then followed to collect outcomes at the earliest of death, discharge from hospital, or 28 days after randomization. And this training module applies to part F of the main randomization, which you can see in the top right of the screen, which is between empagliflozin or usual care alone. And this randomization can be done in addition to any of the others which are available at your site. Empagliflozin is what is called an SGLT2 inhibitor. SGLT2, the full name of which is sodium glucose cotransporter 2, is the main process by which glucose that has been filtered into the urine in the kidney is then reabsorbed back into the bloodstream. SGLT2 inhibitors were developed as treatment for diabetes because they can lower blood sugar by allowing more to escape into the urine. However, trials of SGLT2 inhibitors have shown that they have additional benefits beyond simply lowering blood sugar, and they have been found to reduce the risk of atherosclerotic cardiovascular events, such as myocardial infarction, in people with type 2 diabetes. They also reduce the risk of cardiovascular death in people with heart failure, and they also slow the progression of chronic kidney disease in people with diabetes and chronic kidney disease. There are reasons to think that SGLT2 inhibitors may also be beneficial in COVID-19. They shift energy metabolism from one based on glucose, which the SARS-CoV-2 virus may rely upon, to a lipid-based energy metabolism. They also improve endothelial function and have anti-inflammatory effects. There has been one trial previously done called the DARE-19 trial, which compared dapagliflozin with placebo among 1,250 patients who had been hospitalized for COVID-19 and also had another risk factor for a poor outcome, such as diabetes or previous cardiovascular disease. The primary outcome of DARE-19 was the time to organ failure or death, and this was reduced, albeit not significantly, among people allocated to receive dapagliflozin. The recovery trial is therefore testing a drug called empagliflozin, another SGLT2 inhibitor, which we hope will be available in all countries participating in recovery. As I said at the start, this will be a separate factorial randomization to the others, so this treatment may be given in addition to other study treatment allocations. The dose that we are using in recovery is a standard dose of 10 milligrams given once daily for up to 28 days. If the participant is discharged before 28 days, then the study treatment is stopped at the time of discharge. Not everybody is suitable for this comparison, and the main exclusions include people with type 1 diabetes mellitus or women who are pregnant or breastfeeding. Of note, there are no exclusions around kidney or liver function. SGLT2 inhibitors do have some adverse effects. By far the commonest of these are what are called mycotic genital infections, such as vulvovaginal candidiasis or candidal balanitis. These are most common in people with diabetes. They are easily treated with a topical antifungal such as clotrimazole cream, and usually the study treatment would not need to be stopped. A much rarer but more severe side effect is ketoacidosis. This is most common in people with type 1 diabetes, which is why they are excluded from this comparison. It does still occur in people with type 2 diabetes, but it is very uncommon, affecting less than 1% of people in long-term treatment trials who've received this medication for several years. It is known that the risk of ketoacidosis is increased with starvation. So we strongly recommend that if a patient is allocated empagliflozin, that the study treatment is withheld for any period during which the patient is not eating or being fed. For example, a patient on invasive mechanical ventilation who does not have enteral feeding. It is important to recognise that ketoacidosis in people taking SGLT2 inhibitors presents differently. In particular, they have a relatively normal blood glucose, not as high as you might expect with ketoacidosis. So if you're suspicious of this diagnosis, then it is important to check ketones, ideally blood ketones, to see whether they do have ketoacidosis. SGLT2 inhibitors lower blood sugar, and by themselves they cannot cause hypoglycemia, but if given in combination with insulin or drugs which stimulate the secretion of insulin, like sulfonylureas such as gliflozin, then hypoglycemia may occur, and it may be necessary to adjust the doses of these other medications while the patient is taking empagliflozin. SGLT2 inhibitors also cause loss of sodium and water through the urine, natriuresis and an osmotic diuresis, which can cause volume depletion in some patients. So care is required with fluid balance, as it is with all patients with COVID-19. In order to assess the efficacy and safety of empagliflozin properly in recovery, there are some additional outcomes which will be collected on the 28-day follow-up form. These include whether the patient experienced ketoacidosis or not, whether they had severe hypoglycemia, and by that we mean hypoglycemia which caused a reduced conscious level requiring another person to recover. So this is not simply an incidental low blood sugar, but this is low blood sugar causing a reduced conscious level which required another person to help the patient recover. We'll also collect whether they had other hyperglycemia, high blood sugar levels, which either required a new use of insulin or were associated with a hyperosmolar state, previously known as hyperosmolar non-ketotic coma. And finally, we will also collect the peak creatinine during the admission. So in summary, there are reasons to think that SGLT2 inhibitors, including empagliflozin, may provide additional benefits for patients hospitalized with COVID-19. The recovery trial is testing 10 milligrams of empagliflozin once daily for up to 28 days. Importantly, patients with type 1 diabetes or who are pregnant or breastfeeding are not eligible for this comparison. And the main adverse effect of SGLT2 inhibitors to be aware of is ketoacidosis, and particular care is required if the patient is not being fed. Thank you very much for your help with the recovery trial.